I practice up in Gaithersburg, Maryland. Disclaimers, I work for a bunch of different companies. Right? My job as a sports medicine and rehab specialist, which maybe you don't know exists as an AVMA specialty, is to figure out why things don't walk right and how to make it better. I am not a surgeon, I am not a neurologist, yet I have to do both of those things every day. I did GP outside of Saratoga, New York for the first 4 years and did 9 C-sections on 9 different species in the first 4 years of my career. Injected a bunch of equine joints, and then staying in small animal and went, why don't we inject small animal joints? So I'm a sadist, and after 10 years and being out in practice, I went back and did a residency. And now I inject to the tune of 500 joints a year. Okay? But I started with one. Okay? Arthritis, we're going to talk a ton about, because the reason I work with all these other companies is because nobody has one clear solution for it yet. Right? Who has a replaced joint in this room? Nobody. Excellent. You guys taking. Who thinks they probably need a replacement joint in this room? Yeah. Who takes pills every day for your pain meds? Who's had your joints injected? Yourselves. Cool. A joint is a joint is a joint in a mammal. It really doesn't matter. Okay? Like Tim mentioned, right? Osteoarthritis is the #1 cause of chronic pain. This study was done in 1997 by a couple of veterinary residents calling various GPs on the telephone, not their iPhone, the old thing with a cord, okay, and saying, hey, how many arthritis cases do you think you saw this week? Not can we borrow your medical records, not how'd you confirm it, how many do you think you saw? And they did that to 10 clinics, and then they got that published. So this 20% stuff is based off of calling, I think, 7 clinics in 1996. So I'm going to ask a better audience. I'm going to ask all of you. Who worked this week? Small animal. Let's say in small animal, right? How many of you diagnosed at least 1 arthritic patient this week? 5 arthritic patients this week? 10 arthritic patients this week? Who took a phone call at the break and was still diagnosing somebody? Because I heard one of you doing it. Okay? It's a pandemic, and I'll get into why it's a problem at the end of this talk. We're going to cover arthritis, diagnosis, and steps more in young animals than in old animals. And then the second hour is how to shove needles into things and what's the evidence behind it on whether it makes it better or not. Right? This study just came out, and I love continuing ed because it's continuing. Right? Not only do I get to speak a bunch, but I read journals every week. I meet with my residents. Right? We're always still learning what's changing. This paper came out literally February of this year out of NC State, and they were just trying to figure out, if we figured out with a bunch of these young dogs, how many of them are arthritic? And what joints are arthritic? Right? This study, elbows, hips, those are the 2 biggest joints. These are all in young dogs. Right? Percentage of dogs with at least 1 joint affected. 20% of the dogs in the study had an arthritic elbow. 20% of the dogs had an arthritic hip. These were all dogs under 24 months of age. Right? They're also finding arthritis already here. How young? Okay? Prevalence of OA. Right? 28 to 38 months, 38 to 48 months were a ton. 20 to and 23% under 2 years of age. Yes, sir? How did they diagnose the arthritis? Excellent question. Clinical physical exam, radiographs. Right? Don't need a fancy MRI. Right? Don't need a PET scan. Well, everybody knows what the most expensive thing in all of veterinary medicine is, by the way? Most expensive piece of equipment. You. Dead serious. How many times have you put vet school loans, hours, coming in on you guys are here on a weekend, granted it's a great venue. You could all be home sleeping. Okay, you're investing in yourself. Yes, ma'am?
Did all of these have radiographic changes?
Yep. And this is an open access article. Everybody can go and you can pull it up on PubMed and read it. Right? This was Duncan LaSalle's group out of NC State. So 43% of the dogs in the study were under 28 months of age and had clinical and radiographic OA. think there was 150 dogs total in the study. What they did was, it's in Raleigh. They polled the vet students, the techs, the janitor's dog, the professor's dog, right? They went around what's common to them. Because I love walking through the hospital, right? Where you walk through your local park and you're like, oh God, that dog walks like shit, right? You all see it. And then you start seeing how humans walk and it's even more of a mess, right? So they polled what they knew. But that's the problem. Right? We're talking about OA, osteoarthritis, or degenerative joint disease. We're not talking about septic arthritis. We're not talking about neoplastic. We're not talking about autoimmune. We're talking about something that's degenerative. So we're thinking it should be an old patient disease. Humans predominantly get wear-out arthritis, right? Primary arthritis. You're 90 years old, you've walked a lot of miles, you've worn out your cartilage. That's what cats get too. The vast majority of cats, right? Do you see cats with hip dysplasia? Not really. Do you see cats with elbow dysplasia? No. You see 15-year-old cats that have worn out their joints because we as humans haven't screwed with cat genetics nearly as much as we've screwed with dog genetics, i.e. the French bulldog, right? What the German Shepherd was in the 90s is what the French Bulldog is now. The German Shepherd in the 90s is what paid off everybody's vet school loans in the 90s and 2000s, and the French Bulldog is what will pay off the next generation student loans. OA is degenerative. For 20% of adult dogs, they called 6 clinics and just asked them. No medical records. This was fun. 60% of adult cats. This was another vet school study where they brought in cats for dentals and just took radiographs of all their joints and didn't ask the pet owners, does your cat have trouble jumping? Does your cat not move as well? They literally just took rads and said, 60% of old cats have at least one joint with some OA. The level of evidence in vet med stinks. And I publish, and I review papers, and we're trying to get better. Right? But these are the 2 studies people have clamored on about since 1997, respectfully, for both. There is a new study. Anybody here an Auburn grad? Cool. Thank you. Your alma mater is doing a landmark canine osteoarthritis study. They polled thousands of veterinarians and specialists. The paper comes out. It's some kid's PhD project. Okay? It's coming out later this year. Okay? It'll be the best level of evidence we have in 25 years. What's more important to me is not the radiographic stuff. Nearly a third of owners polled said that bone and/or joint problems were a problem for their pet. So I'm going to go back to you that all raised your hand that diagnosed 5 to 10 arthritic patients. Was it incidental because you found it? Hands up. Was it because they came into you because the thing is old and slow? Okay? Age is not a disease. I ran the Marine Corps marathon last year in DC. I got passed by a 69-year-old grandma. How do I know? Because on the back of her jersey it said, congratulations, you just got passed by a 69-year-old grandma. Love it, right? And I was like, she was also 5'1" and 85 pounds. I'm like, you better, you're half my size, right? I had a longer stride length, but she clearly had a better gait cycle than I did. But that's what matters. Why did we all get into vet med? To help animals. It's the oath we all take. So we do a ton on preventative medicine for parvo and pneumonia and rabies. But when there's 34 million dogs apparently diagnosed with OA every year, why aren't we battling this epidemic? Because they care. They're coming to you for it. OA has to be thought as a global disease. It is no longer, if you take one thing out of the next 2 hours of me talking, arthritis is not a cartilage disease. It is a synovial disease. The synovium provides the nutrition to the joint. Cartilage is aneural. We're all taught cartilage has no nerve endings. And that is true. Why on earth does arthritis hurt if cartilage has no nerve endings? Because the synovium is jam-packed with all the nociceptors. It's a synovial disease. The synovium provides the nutrition to the joint. By the time we see osteophytes, it's already most likely an end-stage joint in some areas. Think about it. Who's diagnosed an osteosarcoma dog in the last 6 months? Cool. You took chest films, right? Even if they were negative, we know that the pulmonary met has to be bigger than 4 millimeters in order to show up on chest films. Guess what? Osteophytes are like pulmonary mets. They have to be 4 millimeters to show up on films. So this is where the problem is, and in dogs it is secondary. That means it's secondary to a bigger problem. Elbow dysplasia, which we'll get into, hip dysplasia, cruciate tears, OCD of the shoulder and tarsus, okay? And unfortunately, which I don't have time to get into talk about today, obesity. 3 out of 4 dogs and 3 out of 4 cats now qualify as obese. Right? Putting all that extra weight on those joints mechanically just stresses them out. And also, other fun thing, fat is not inert. Fat secretes enzymes that imbalance the joint and drive it to more of a catabolic state. So even when you're sleeping, your fat is actually trying to make your cartilage worse. It actually triggers your synovium into an inflammatory state, regardless of what species of mammal you are. So I'm a big fan of, if you know you're normal, your abnormal sticks out really well. On the left side of the image is the normal joint, right? The cartoon that we've all seen in a bunch of different places. On the right is the inflamed joint. Right? Cartilage is less. We get maybe more bone-on-bone contact. We have a thicker capsule. Let's do something simple. And most everybody's wearing shorts. Put your feet flat on the ground for me. Reach down and feel your own patellas, not your neighbor's. I didn't say it once and somebody did it, right? Use your fingers like little claws, and on either side of your patella tendon, you should be in a concave area. If you are not in a concave area, if your knee is flat or convex, congratulations, your knee is effused. Same thing works for your elbow on either side of your olecranon. If you hold out, not at 90, hold out a little bit past 90. Other thing, whether knees or elbows, your joints should be the same width. So go condyle to condyle and condyle to condyle on your 2 elbows and hold them up and compare them for the room. Because the wider joint is the more problematic joint. Same thing works for the knees, the ankles, and the wrists. Again, doesn't matter what species of mammal you are. It does not work for shoulders and hips because we have too many muscle bellies around here. But just compare it. If it's wider, it's asymmetrical, it's a problem. And that you can do in a gentle touch, right? Doesn't matter if the dog's scared of you, you're scared of the dog, cats, right? You can do any of that stuff also under sedation. So what happens is there's an instability in a joint. Right? A cruciate tear, you're stretching that around. A fragmented medial coronoid process and an elbow with elbow incongruity, there's instability. Hip dysplasia. In one word, the driving force of all hip dysplasia is laxity. Because if you have a nice tight hip joint, you're fine. When it's loose, it bounces around, and then the acetabulum doesn't grow well, and it grows osteophytes. So instability starts at the top. You're then stretching that joint capsule abnormally. That leads to synovitis. When the synovium's not happy, it goes out of this balance between catabolism and anabolism, the homeostasis of a joint. When you have more catabolism than anabolism, you get more pro-inflammatory mediators, you get more junk, right? You trigger all this stuff, right? In humans that have rheumatoid arthritis or psoriatic, right, that are autoimmune diseases, or we have dogs that have IMPA, immune-mediated polyarthritis, something else triggers it. It's not the instability, but it's a gene, right, or it's an allergy, right? And then that drives up the inflammatory problems. But the instability here is what starts this one for degenerative OA, And then that signals the macrophages. And the macrophages come in and go, you're inflamed. What am I going to do with you? I'm just going to start eating stuff. Because macrophages are like Pac-Man. They just gobble up whatever in front of them. Right? They're like frat boys at an all-you-can-eat buffet. They don't care. Right? They'll sweep everything out. But they eat cartilage. They eat synovium. They're non-descriptive. They just eat away. And then that leads to cartilage erosion. That leads to more pain. That leads to more arthritis. That's that vicious cycle that spins and spins and spins. So you get that thickening. I'm going to throw out some terms you probably have seen on different radiology reports or maybe have some flashbacks and PTSD to school. Right? There's a fibrotic joint capsule. There's medial buttress. There's sclerosis, right? Because the bone doesn't like it either. Right? The bone gets thicker in that area because it's going, you're pounding on this too much. Let me try to build up a callus of bone is sclerotic bone. Right? Those synoviocytes release things like bone morphometric proteins and MMPs and interleukins and right? Tumor necrosis factor, right? Things that are nasty. We're not going to get into all that micro stuff at this point. Right? But it becomes a vicious cycle. But what happens is dog's not in pain. Dog don't cry. Dog not in pain. Dog walks in three-legged lame. He's not crying about it. He's not painful. You touch that nice dog anywhere else, and it's a happy Labrador. You touch that joint that's horribly effused and fibrotic, and that dog tries to bite you. That dog's in pain. That dog's in a chronic pain state. It's easy to appreciate a dog in an acute pain state. Right? Dog gets hit by a car, it's in pain. Dog that's been quietly suffering silently with bad hips and slower to rise and slower to lay down and doesn't want to walk because it's a lazy dog is quietly hiding in chronic pain. You then get damage to all different areas of that, and the joint is an organ. Right? We take care of the liver pretty well. We have liver supplements. We take care of the GI. We're trying to take better care of our brains and our kidneys. The joint is an organ. The bone, the cartilage, the periosteum, the synovium are all players in this microenvironment of the joint. And if you keep that in a happy state, it's fine. But once it gets out of balance, you get into trouble. And when you get it into trouble, because the synovium has so many nociceptors in it, you get what's called neurogenic inflammation. So the little nociceptors there go, oh crud, I'm overloaded. I'm not going to shut down and not tell the brain that there's pain. I'm going to create more of my friends. I'm going to create more nerve endings, and we're all going to send this one big nasty message up to the brain. So you actually turn up the volume of a bad concert. And that's neurogenic inflammation in a moment, right? And it actually gets driven by various other micro mediators. So that pro-inflammatory mediators then initiate that pain. You keep getting that message that goes up to what's called the DRG, or the dorsal root ganglion, in the spinal cord, and it just sends the message up to the brain. And constantly, all the time, it's getting overwhelmed. Can I borrow your hand for a second? If I do this, everybody can, I'm just tapping on his hand. Right? Does that hurt, sir? Cool. If I did this for the next 6 months, when would you punch me in the face? Okay, I'm going to step back now. Okay? Low-level pain all the time. Right? That constant drive with every step. That young dog sit. Right? Why do puppies lay down? Right? Their glucose is too low. Or they hurt. Right? Dog that self-limits. Wants to play, just lays down. Because both hips hurt. Right? It's on there all the time. So OA is a chronic progressive disease. It ebbs and flows. So there's going to be acute on chronic. You're going to have bigger flares, and it's going to be really problematic. And a dog who I saw this week, they knew it was arthritic. GP had been doing a great job managing it. And for whatever reason, mom decided that that was the day to take the 7-kilogram little mutt and walk it for 5 hours. Thankfully, it didn't get heat stroke. And she goes, I don't know why his elbow hurts. I'm like, if I walked you from DC to Baltimore, barefoot, would you be painful? And she's like, oh, I didn't think of that. Okay. We have a lot of education to do. So where do you find these? If you do a solid physical, an orthopedic exam and neuro exam, a lot of people get scared about. You get really proficient at it. An ortho and a neuro exam you can do in about 7 minutes. And having done GP for a decade, I get it. 15-minute appointments, quadruple booked, 3-block cats, and the squeeze in for the ear infection. That was his yesterday, I think. He's chuckling enough, right? But you can do an ortho exam pretty quickly. And you get down to it, you do it on every one. So they come in for vaccines. You have your techs ask, when was the last time you went for a walk with your dog more than 4 minutes? Oh, it doesn't walk anymore, it's old. It's an 8-year-old beagle. That's not old. So you do a solid physical on every annual exam. They come in for otitis, check a joint. You feel every joint all the time, then it becomes as good as you all are in catching everything else that you catch in GP. You catch out the problematic joints. But you have to do this in the juveniles. Right? The puppies are key here. They come in for those monthly boosters, keep feeling those. Let them bend. Right? Puppies should be like loose noodles. They should just people bend every leg and doesn't care. If you can't do that and it can't sustain out hip extension and it do anything anywhere else and it doesn't, something's not right. And if we can catch it as early as possible, we can intervene in lots of different ways. Because as much safe as all these medications are out there, do we want to tell somebody at 6 months of age with their puppy that they're going to be on a pill every day for the rest of their life? That's not how we all grew up, hopefully not. That's not how we want to kind of be. Right? That's not the goal. So take it from the techs, take it from the owners that are coming in. Look for symmetry. Joint symmetry, felt about, effusion. Dog stands there, right? Remember, you get paid to pet pets. That's what I tell my interns all the time. They're overwhelmed, they're trying to remember every scientific paper. I'm like, pet the dog. Pet the dog, calm down, and then feel it symmetrically. Gee, dog's standing there. This thigh is this big, the other thigh is this big. This is the problem thigh. Right? Dogs don't get big giant lipomas and don't carry adipose tissue in their thighs. They atrophy the leg that hurts all the dang time. They just don't walk on it because they have built-in crutches. Right? We walk, if we had as bad hips as dogs do, right, we'd be on crutches and walkers from the time we're 10 years old. Dogs do. They just put all their weight onto their front leg. So watch how the dog just sits in your exam room. Falls like a sack of potatoes and can't stand up, and it's not a slippery, horrible floor. The dog's telling you something. And you're going to catch that on your physical way before you will see that on radiographs. And that's good, right? We want to figure those things out. By the way, before I forget, if anybody wants, if you email me later, I will send you a PDF of these with all my notes in them, so you don't have to be scribbling stuff down either. Okay? The big 6 joints that we have in animals are the areas, and I put them in order of how many we see and per that study too, right? Elbows and hips are our top 2 arthritic joints. Stifle, then shoulder, then tarsus, then carpus. And then I will throw in there, which I need to update this slide, actually above carpus for me would be digits. My hunting dogs, my border collies that have actually worked sheep for a decade, right? They have hands like this. The elbow's fine, the wrist is fine, the toes are screwed. Okay? The interphalangeal joints are screwed. And I will manage those just as much because they hurt. So those are the big joints. Here's the why by joint if we break it down. Elbows, it's elbow dysplasia, the most common thing. It's multifactorial. I could spend 4 hours just talking about elbows. Let's not do that. You can get what's called IOHC, which is incomplete ossification of the humeral condyle. It's originally seen in spaniel dogs, and now we see it in Frenchies. The Frenchie that steps off one step and shatters its elbow is because the growth plate between the two humeral condyles did not ossify. And so it's a non-traumatic fracture of the joint. And when you shear that elbow apart at 5 months of age, that dog is going to have a lifetime of arthritis, even if you surgically repair it appropriately. Hips are hip dysplasia. Stifles are cruciate tears. There's actually a paper showing that dogs with cruciate tears versus dogs with just patella luxations, which one do you think gets more stifle OA radiographically? Cruciates or MPLs? Cruciates. More instability. Shoulders, predominantly OCD in the large breeds, so you can catch it on plain films at 6 to 12 months of age. Little tiny white dogs and corgis love to get horrific shoulder OA. And it'll be really nastily painful. Tarsus, for the most part, is an OCD. It's Labradors and Rottweilers until proven otherwise. Those are the top two breeds for them. Carpus, thankfully, we don't see a lot of carpal OA. And that is purely, where's our equine colleagues in the room? That's your problem, for the most part. Most of it is developmental, so what's called developmental orthopedic disease. Yes, can you get trauma? Absolutely, to a joint. Can you get a growth plate fracture? Can you get Lyme disease or anaplasma that may cause some, right? Maybe, but that's not nearly as much as our degenerative and developmental. And thankfully, for the most part, we don't get a lot of infectious or autoimmune as compared to what we do with other aspects of arthritis. So it's secondary, and you have to make them aware. Right? This is why I want more pets insured. This is like if they get insurance from like the shelter, don't let it run out. Because if it's a Newfoundland mix, it's probably going to have two shitty hips, a cruciate tear, and shoulder OCD.
Are you going to talk at all about them wanting us to spay our larger breed dogs later?
I do not have 4 hours. I love that topic about getting into spaying and neutering. That's a whole nother hour, and I don't. I wish I could. Right? It's a great point. Like trying to figure these out is tough. Right? So you do a solid physical. You look for atrophy and thickening. I'll even throw in here cats. Don't forget about cats. Right? It's hard to do a physical on a cat, but even if you just pet it and one elbow is this thick and the other one's this thick, trust me, that cat hurts. Right? And you got to get films because when it's 6 to 12 weeks to get in with a specialist sometimes, if you think it's arthritis, it probably is. But also, if it's a 9-year-old Labrador and it's painful in its front leg and it's kind of sort of painful in its shoulder, it could also be that osteosarcoma. And if we wait 9 to 12 weeks for it to get to somebody else, we then take films and it's already got pulmonary blooms all over the place. So I always joke, right? I wasn't born on Krypton. I don't have X-ray vision. Take some X-rays. See how bad it is. There's things that I would like, man, this feels like a really horrible worn out joint. That's weird. Took a film. The microchip had migrated at some point into the joint. We had to go in and fish out the microchip. Okay? Dog had a foreign body for right? And just the microchip had been scraping through the joint. So no amount of carprofen is going to make that better. So you don't have X-ray vision, get X-ray vision. Are X-rays perfect? No, but they're still better than not taking them at all. But you got to take them well positioned, get good straight views, do them under sedation. The animal hurts. Dexmedetomidine is your friend. Right? Sedate them, get decent films, send them out to a radiologist, post them on VIN, right? Whatever else, figure them out, and get a sedated orthopedic exam at that same time. It's hard to see. Can everybody see this elbow radiograph pretty well? Not so hot? A little hard with the lighting? This is a 14-month-old dog, yet it looks like a 14-year-old elbow. Okay? So we get some info here. They're pretty helpful in understanding where they are. The thing that's actually probably more helpful, and this is free. Anybody a Penn Vet grad in here? Not the right name? Penn is notorious for being super expensive and charging for everything. They gave this away for free. This is what's called the CBPI, the Canine Brief Pain Inventory. Whoever's gone to PT for yourselves, you fill out the questions every time. Does your pain impact your ability to drive, read a book, sleep? That's this for dogs. NC State came out with one that's 18 questions for cats. That's how they validated Silencia. CBPI, Penn came up with years ago. It's now the standard of care for all the canine OA studies. Because it's 10 questions you ask the same owner every time. How does it impact? Because RADs, we take once. We may not take them again unless there's a big change. You can do your physical and the dog's pretty comfortable or it's uncomfortable, but how does it impact at home? So you can download these for free, and my techs have my owners fill them out before I go in, and I don't look at them until after I do my physical so that I'm not biased to what they're thinking. But you can ask simple questions on how it impacts. But the pathophys, remember, arthritis is not a cartilage disease, it's a synovial disease. We don't see the synovium on radiographs. Anybody doing arthroscopy? It's okay. We don't do a lot of it. What we can do, that's the only way we truly see it. And it's to open up the joint. We can get a little bit better with CT. See if this will play. CT I love because I can actually get, if I have worries about, let's say I have a bilateral thoracic limb lameness in a golden retriever, and both its elbows and its shoulders hurt. By the time I get 2 views, 2 views, 2 views, and 2 views under sedation, a CT is actually cheaper and has 3 times the amount of detail. How old do you think this, why is this not playing? How old do you think these elbows are? They're gnarly. There's nothing smooth, even if you've never seen CT, right? Elbows should be like door hinges. They should be perfectly smooth. All of this is all arthritic change in both of them. How old is this Labrador? He's under, we did his CT on his first birthday. Okay? And while we can replace hips, only about 50 dogs a year get an elbow replacement in the United States. We are not there yet, folks. What do I do for the next 15 years for this Labrador? If you haven't gotten into scoping, get into it. It's really fun. I love scoping because I can do it under DexMed. And I don't work for Arthrex. I just like this one I have. There's a couple of different needle scopes now that were designed for humans. So they're use once and dispose on the probe, and the tablet's $20,000 or $30,000. But you can re-autoclave these and get a bunch, and you can see inside those nasty joints. And now they even have nano tools. I can do meniscal debridements. I can do elbow debridements. I can do shoulder OCT debridements, all with this. Okay? What I really help about is that it gives me what's called a modified outer bridge score. Because even though the cartilage is not the pure problem, the cartilage is the glide force here. So a modified outer bridge score, normal healthy hyaline cartilage should be white like marble, and with arthroscopy I can put a probe in too and I can push on the cartilage, and it should be nice and firm, just like a table. It should be able to hold up. This is not a bad image. It's good resolution. This cartilage is pink. Cartilage should not be pink. It's chondromalacia. I put a probe into that, it sinks like a hot knife through butter. There is no protective impact in that cartilage. And then cartilage starts to chip away, so it becomes fibrillated, or even down here, okay? This is that dog that, in the CT from before for his first birthday, we popped in because we wanted to make sure he didn't have ginormous fragments that had to be removed. No, he was already down to subchondral bone on subchondral bone by his first birthday. That's not coming back, right? Hyaline cartilage does not come back. Nothing magical will regrow it. At best, we're going to get fibrocartilage, and we'll take that over bone on bone. But this is what you can see with scoping. So it is helpful. Because this one, right, shouldn't cartilage be white? Yes. This entire elbow, so here's the humeral condyle up here, here's the ulna, and this is the radius. Okay? This entire joint is pink, and it looks like pebbles. This entire joint, this is a different Labrador. This entire joint at 12 months old is bone on bone. What you see in the corner looks like sea anemones, right? That is the overgrown synovitis. And so this stuff is just pouring battery acid onto the cartilage, and the cartilage just melts away, and it's done. It's not just our problem, it's the UK's problem too. Right? They did a study, what breeds, looking at elbow disease. What did they find? Yeah, they found Labradors, Golden Retrievers, and Rottweilers. We got the same dogs no matter where we are. Okay? But what kills me here is when they asked owners, they said only 1 out of 7 owners said their dog was in pain, but those same owners, 3 out of 4 of them, they said their dog limps. We have to do better. If it limps, it hurts. So that has to get better. What really sucks, and there's no nice way to say this, elbow arthritis led to euthanasia in 40% of dogs that died during the study. 40% of the dogs they were looking at had to be euthanized due to their chronic pain. And in the UK, 95% of dogs are insured. So they get whatever they need. We just don't have a great solution yet, because they're only still replacing about 20 elbows a year in the UK. We don't have an easy system like a TPLO to pop into elbows yet. We're getting there. We're way better now than we were 10 years ago, but we're not there yet. So we're in a management mode. Elbow dysplasia makes up so if you looked at the top 50 breeds in the OFA database, 16% of the top 50 breeds suffer from elbow dysplasia. So the top breeds that are being sold day after day, shown at shows, are popular on Westminster, and everybody goes and buys one. We're creating this problem. It's known as medial compartment disease because it's an umbrella, because we still don't know what causes it. Right? Some of it, the biggest key is incongruity. Where hips is laxity, elbows should be congruent. And the moment they're not congruent and it rubs the wrong way, something starts to give. So if that elbow is not perfectly congruent, like a perfect door hinge, it's going to wear out faster and faster. Radiographs still tell you a lot, because here, right, the anconeal process has a separate center of ossification. It should seal at 22 weeks of age. Anything past 23 weeks of age is abnormal. German Shepherds, Mastiffs, top 2 breeds. Painful elbow, 6 months, they're coming in for whatever they're coming into GP for. They're lame, radiograph. Flexed view, so that you can show the anconeal process. You take the other side for comparison. This one's fused, this one's not. This one needs surgery. Most of the time, we're still just taking these out. In some cases, if you catch it early enough, somebody can drive a screw through that and actually reattach it. Okay? But you can catch this super early. Our little one, since there's a dachshund in the room, right? Dachshunds are the #1 breed to not have joint arthritis. There's a study out of Germany. Okay? They're the least represented breed for limb OA. Their spines are a whole different story. Okay? But those dogs that have ALDs, or angular limb deformities, right? The corgis, right? Toes should point forward. When toes point east and west, what suffers? The elbow. The ulna growth plate closes early, the radius bows. The carpus doesn't care. The elbow gets jammed day in, day out. And then what also happens with those is they throw it up to the shoulder and the glenoid actually twist, and that dog rubs its cartilage raw. So it comes in, the corgi that can't stand should check it for a disc, the first 10 things you look for. But when its neuro exam is normal, start looking at which way its toes point, because it's probably worn out the 2 joints up here. With an ALD, yeah, depending on what they are, you can still get them to a good orthopedic person. They may be able to correct it, or you manage the arthritis. And even if they correct the ALD, you're still going to manage the arthritis. But yeah, you can absolutely help them. So you have to check for discomfort of an elbow. Here's the keys. The easy takeaways to do your orthopedic exam. Everybody do me a favor. Without hitting your neighbor in front of you or side, extend your elbow out all the way and count to 5 with me. 1, 2, 3. If it hurts, pull away. Cool. Flex all the way. Pat yourself on the back. Count to 5. You're doing great. Come out a little bit. Still flex without punching yourself in the face. Rotate your fist, pronate and supinate. If any of those things hurt, your elbow has a problem. You can do that to any animal gently. You do that to a puppy, you do it to their other leg, right? You flex their knee and flex their hip and you extend this and it doesn't care. You do this to their elbow and they repeatedly yelp. That 6-month-old golden that comes in for the soft tissue injury for the front leg, it's this. The tendons are compensating, but that dog has early onset and early elbow dysplasia. It has like chondromalacia. It doesn't have a big clunk of a moving fragment, but it already has cartilage disease. Because when you do this test, there's no shoulder movement. So if he hurts here doing this, or he can't keep it hyperextended, it's the problem and the pain. And we all have gotten well to the point where we know that a back leg issue is a cruciate till proven otherwise. I'm telling you, a front leg is an elbow until proven otherwise. Right? You've seen this dog. Who has at least one of these dogs in their who saw something like this week? Right? RDVM's personal dog, 14-year-old pit bull. Right? Both knees have had TPLOs. Right? But look at those elbows are here. Okay? Toes should point forward. Olecranons should point caudally. When the olecranons are pointed east and west, and even if the toes are still forward, compensation because the elbow's medial compartment hurts, so they offload. If you look at their paw pads, their lateral surfaces will be buffed smooth. The medial surfaces of their paw pads will look like a Brillo pad because they're not buffing down the pad. But, oh, come on. Video. This dog. Yes, he's as fat as a moose. Okay? He's 2 years old. No, he's not hypothyroid. Mom thought he was. We ran it. All of his thyroid was normal. Okay? This dog's eating 8 cups of food a day and walking less than 15 minutes a day. 'Cause he's hungry. Okay? But look at how he walks. So take dogs upstairs, they'll bunny hop because their back legs hurt. Bring them back down the stairs and watch how they walk. Come on, do it again. Right? The front, boom, he can't, if I slowed him down, I made him put 1 foot down, he stopped and sat on the stairs and waited and was done. Because he's so heavy, when he puts all of his weight onto one elbow, he hurts so much he stopped walking. Labrador. Things that are designed to move. Stifles, I already mentioned this, that MPLs get less OA than cruciates, but still be aware of them. And just trying to find, this is all juvenile, right? Elbow dysplasia, juvenile. MPLs, right? Juvenile. Yeah, they skip. They don't skip that much, okay, but like maybe still they're going to rub out their cartilage. And that pit bull who has really post-legged, right? Maybe we're spaying them too early or not. We'll get, can't get into that right now. But they're putting shear force on that cruciate. Who's diagnosed at least one dog with a cruciate tear before its 2nd birthday in the last 30 days? Look around. This is not an old thing disease. Hip dysplasia. Are these hips good or bad? Bad. Right. There is no coverage. This dog is out of socket. Right? Laxity is the word. It has for all these reasons. Okay, and every one of these radiographs, it's a little hard to see, but every one of these radiographs is a dog under 2 years old that I've seen. So don't be like, oh, it's a 14-year-old dog with end-stage hips. No, no, no. These are all trashed. Early trash. Diagnose it, right? Large, fast breed-growing dogs. It's all your physical. And you are on the front line. So at 12 weeks, if its hip pops in and out of socket, is a problem. 16 weeks, it walks like this, it's got a hip sway, and it pops its hip out of socket, It's a major problem. You can catch it early because the disease is biphasic. You either have the ones that are crippled before their first birthday or subtly hide it and at age 5 look like they're 98 years old. Right? They're done. So you have to catch, you're here, you catch this early. Non-weight bearing lameness is rare. So if it's holding a leg up, it's probably not the hip. Probably not. Also think about this for a second. Flex your own hip if you can right now without banging into the table. Hip flexion shouldn't hurt. Hip dysplasia is a loss of extension. So flex every hip first to get the animal used to you. It shouldn't hurt. If hip flexion hurts, sedate them and get a frog leg radiograph of that pelvis. Because 9 times out of 10, that dog has a femoral neck fracture, a capital physeal fracture, or weirdly enough, a tumor or bone metastasis. Gastric adenocarcinoma likes to met to the proximal femur. I've had 4 cases in 20 years that came into me as a lameness problem without GI signs yet. And I found pain on hip flexion. We took a film, mature dog, huge sunburst periosteal. We start looking, gastric adeno, gastric adeno, gastric adeno, gastric adeno. So you are the diagnosticians. You are there to know what normal is, and if this is normal, it shouldn't hurt, and it hurts, figure it out. The reason it has to be a frog leg if it hurts on flexion is that if it is a capital physeal fracture or a femoral neck fracture, and you do a VD extended, you will line up the fragments and you will miss it. And most radiologists will miss it too. So you have to take the right radiograph for the right problem. Right? Does anybody know why dogs' hips sway when they have hip dysplasia? Cool. Think about it. If you're doing a lunge, right, you push off, you want to maximally extend your hip. I just said that hip dysplasia is a loss of hip extension. So I can't do a lunge. So in order to ambulate forward, I swing my trunk so I don't push off as much when my hip hurts. So you sway because they're using their apaxial muscles to glide like this without extending their hip. It's cute, is what owners say. It's a sign of pain. Because the ortolani will go away. The popping in and out, that goes away by a year because the joint capsule fibrosis is down enough. Is this Bernese Mountain Dog normal or abnormal? Correct. Posture. Okay? And it's on the hip slide, so it's clearly a hip problem, even though that hock is so straight. That hock is so straight it will actually break forward when the dog walks. So they'll bring him in. This dog came in to see us because the owner goes, his ankle's weird. And then we said, how far can you walk your dog? Oh, after 4 minutes it lays down, it does not walk. This dog is 11 months old. This was surgery pre-date. We'd already worked it all up. Both hips replaced before it was 18 months old. Because both hips are out of socket and grinding into nothing. So radiographs, trust me, they're chronically painful. Just knock them out. Okay? Knock them out, do an orthopedic exam. Struggling to get films awake on these things when they're in chronic pain, the moment you go to position them, they're going to bounce off the table. This is what we want. Femurs are parallel and extended. We get the knees all the way up to the ilial wings, if not L7, in there, and the femur should be parallel to the spine. Because that's how you can make a good understanding of what's going on, and your patellas are centered and your fabellae are bisected. That's how you know everything's lined up. Now you can make an appropriate understanding of the hip joint. I can't tell you much. I can tell you there's no fracture. I can tell you there's no major periosteal reaction, but I can't comment on the congruity here. This one, the hips are straight, but the knees are bent like this. You couldn't extend them all the way. Again, you can't make a good answer off of that. These I will show people at the break if it's a little hard to see right now. This is all dogs with good congruity, but already all have osteophytes. Here's an easy one. My dog has no acetabulum. It's just a garbage hip joint. These are all, if you're not looking for it, you might read out as normal. So in this day and age with telehealth and with teleradiographs, and if I had to go back, I would be a radiologist because you sit at home and read films all day, right? Just send this out to somebody. Get somebody to read it. If you're not sure what it is, get 2 views and send it to somebody, okay? Because these were all read out. They were thought to be normal. They'd come in to see us, and they're like, oh, you already have films. I'm like, let me see them. And they hadn't sent them out to a radiologist, and I was like, I have a radiologist next to my desk, and I was like, what do you think? And they're like, osteophyte, osteophyte, osteophyte. So we already had our answers from the films that were taken by GP, but they didn't have a diagnosis, so we work as a team. Not expecting everybody to know everything about every little subtle osteophyte in the world. Because don't ask me how to treat otitis, right? I still lean on all my classmates. My dog got an ear infection last week. I was like, what do I do? 2-year-old dog, folks. Okay? 2-year-old dog. Catch this, right? This is the one disease I do love because we can cure it. Thousands of well-done total hip replacements get done in dogs and now in cats every year. We've got that nailed. Okay? If they're insured, if the finances are right, I realize that type of stuff. There's a paper that came out in JAVMA just about a month ago at a Minnesota's vet school. If the dog is under 8 years old, it is financially beneficial in the long run to replace its hip than to manage it on a pain med for the rest of its life. The owner will spend less money in the long run to do a total hip when it's a year old than to just manage it on pills. And you get a better outcome. This hips looks pretty good, right? A little hard to see, but trust me, this dog's hips look really, really good. Okay? Nice, deep-seated socket, no osteophytes. Ha ha. Anybody do pen hip? If you're seeing a lot of breeding dogs, please do pen hip. Okay? It's math. It measures exactly how loose the hip joint is. Okay? Antec bought it from Penn, so you can go to your Antec reps and you can take the class online. It's super easy now. Looks really good. These hips are completely out of socket when they're stressed. Pen hip mimics the weight bearing, and so it drives the hip out of the socket. The reason that dog sways is because when that dog is weight bearing, the hip is so loose it actually flies out of the socket and subluxates. That's what pen hip mimics. You want a number less than 0.3 as your ratio. Anything below 0.3 is abnormal. This is a 1-year-old dog who was supposed to be breeding stock and sport. This was supposed to be a field trial dog. Looked good, but had a hip sway, and I was like, I don't trust this. Boom. Now, the average golden retriever in the 50,000 dogs in the pen hip database has a pen hip score of 0.54. The average golden is moderately dysplastic every day. The average Labrador is 0.47. It's also moderately dysplastic every day. So these are super helpful. Again, primary care level. You don't need CT, you don't need MRI. This is a way to objectify and measure how loose those hips are. Because if you can catch this, okay, pen hip isn't, OFA isn't validated until 24 months of age. That dog's already mature. Anybody working with police dogs, search and rescue? I tell them the dog's 2, it's already been working for a year. And you find it, do an OFA at age 2, and you're like, oh, we're going to have to retire you. Pen hip is validated to 16 weeks of age. So at 16 weeks, you can screen your police dogs if they're breeding. You have field trial dogs, screen them at 16 weeks. You'll know exactly what they are. And there's a surgery, before we get to a total hip, which is not cheap, can't be done roughly until a year of age. How do you help that dog if it's 16 weeks and it's this loose? Right? This loose, they have to wait until they're a year of age. It's too loose. They have to have a total hip if they're going to manage it. in the ideal. But there's also what's called a JPS, okay, so a juvenile pubic symphydoesis, where they go in and fuse with cautery the pubic growth plate. And that fuses the floor of the pubis, but the acetabulum then get to grow over the femurs, and you can actually reduce the laxity. But a JPS can only be done between age 15 weeks to 18 or 19 weeks, depending on the breed. So you have a super narrow window. So you see that puppy for its 8-week vaccines. What are your goals? We want to be world trial Olympic Frisbee dog. Great. Week 12, second set of boosters. Puppy walks like this, doesn't walk a lot. Hurts in its hip. You pop it in and out of socket while you're doing your vaccine exam. In 4 weeks, let's do a pen hip. Because if the score is in the right range, I call my surgeon that day. I go, hi, what are you doing tomorrow? I need you to JPS this. Right? Because it takes him about 6 minutes. It's an easy surgery to do. Okay? There are complications. It has to be done right. I know some GPs that do it. Learn it. Right? But it can be done with cautery. But you've got to catch it early to do that. Okay? So you have those that come in that are blatantly limping, or you have the ones, right, that are coming in for vaccines. But these are all conversations to have, because this is how we treat OA. NSAIDs, amantadine, right? Pre-GAB opioids and gabapentin all have question marks because there is no evidence-based medicine whatsoever for any of those three. I'm not saying anecdotal is bad, but there is nothing proven that these work for OA. And there's more and more papers that gabapentin's not doing it. Okay? Amantadine has 1 paper out of NC State. We can intervene, bold and italicized, because nothing beats it. Don't get fat and walk your dog every day. Nothing beats those. Human medicine, nothing beats that. Right? Veterinary medicine. And then here's all the other options, right, with varying degrees of evidence, which I all like and all can work on good things. We'll obviously talk about intra-articular therapy. It might take a minute, but nothing beats walking. Walk the dog every day. If you don't have I tell people, walk your dog an hour a day, even if you don't have a dog. Most people don't walk enough, right? Go out and walk. There's an article recently that if you walk for 15 minutes after you eat a meal, you lower your glycemic index enough that you lower your risk for type 2 diabetes. By walking. Just get outside. NSAIDs are our cornerstone, 100%, right? The dog feels bad on a Friday afternoon. It's going to feel better in 3 days with an NSAID, not by putting it on a joint supplement or waiting for the surgical consult or whatever else. But what happens when the owner declines it, or the dog's in renal failure, or it perfed a GI ulcer when it was on something? And what happens when we've kind of lost the pharmacy if you don't have an online pharmacy? And to be honest, were we really designed to go to vet med to be pill pushers? No. What can we all learn new things? I'm going to take a break in a minute, but I want to leave you guys with this. Why aren't we diagnosing this more often? I think there's 2 things. I think it's biphasic. Number 1, completely, we are all overwhelmed. We have stacks upon stacks of appointments. We're quadruple booked. We don't have enough support staff. It's a weird time in vet med, 100%. AVMA guidelines for education for every AVMA accredited school. Do you know how many hours you get on osteoarthritis education? 1. Anybody remember what's called a Billroth 1 or a Billroth 2 procedure? Anybody? Yeah, gastric bypass. You know how many hours there are in the AVMA standard of education for those lectures? 2 hours. Who in this room has ever sent a dog for a Billroth 1 or has done a Billroth 1 or Billroth 2 in their career? Yeah, I see you. 2 of us. I saw one in my hospital last week. It's the first time in 20 years. I actually took a picture of the dog. Okay? Yet how many of you have diagnosed OA? I think there's a failure in the system. I think we need to do better. Okay? If anybody of you is an AVMA delegate, I will gladly discuss this with you. Okay? I think we need to do better. Of the 32 stateside veterinary schools in the United States, 18 of them you can now graduate from without taking ortho and or neuro in your third or fourth year. They are now optional. As a 100% small animal veterinarian, you don't have to take ortho and you don't have to take neuro. And if you do take it, what do you see? You're the 8th person in the room and they're doing 7 TPLOs. There are 5 or 6 of me, sports medicine folks at various academic institutions, and only like 4 or 5 sports medicine residencies. So there's only like 150 of us. There's 2,000 surgeons. There's way more GPs. Right? But there's not enough of us to just turf it to a specialist. And now, with all due respect to corporate medicine, when they're signing veterinary students to 4-year contracts before they start their 3rd year, at $250,000 salary with $150,000 signing bonus, the schools are telling them you're worth it. You don't have to do a rotating. We've educated you enough. You can go be a GP and Mars and wherever else is paying you buku bucks with no mentorship guaranteed. This is why mobility and animals will be in chronic pain. This is why we're not diagnosing it more. It's not being talked about. You're not being told it. Right? So if you have a passion for it, go learn it. Ask people. Read a book. Take a course. Ask questions. Remember, none of you were born on Krypton, so take x-rays too. Right? Why don't we take a 5-minute break? Thank you all very much.